The $1 billion death knell. Medicare's cut threatens to shutter home health across the America. Welcome to Expert Billing Talk. Today we're going to look at something pretty serious. The ripple effects a proposed Medicare payment cut could have on home health care all over the country.
Yeah, it's definitely causing a stir. What we're actually looking at is a proposal for 2026. It's a cut of about, well, $1 billion from Medicare payments to home health agencies.
$1 billion.
Exactly. And specifically, that translates to a 6.4% rate reduction. That's the number everyone's focused on.
6.4%. Okay, so I imagine that's causing some significant worry,
Yeah.
especially given what we've already seen happen.
Oh, absolutely. Widespread concern is probably an understatement. You talk to providers, trade groups like LeadingAge or the National Alliance for Care at Home, they're deeply worried. They think this cut could genuinely push many providers, especially smaller ones, right out of business.
And haven't we already seen a fair number close up shop?
We have. It's quite stark, actually. Between 2020 and just earlier this year, 2024, something like 900 home health companies shut down nationally.
Wow, 900.
Yeah. It really shows you how tight the margins often are in this sector. They don't have a lot of cushion for cuts like this.
Right. So can you give us a sense of what that actually looks like? I mean, on the ground for
Yeah.
patients when these services disappear.
Sure. Let's look at Nebraska. It's a good example. They've lost 10 providers over the last 5 years or so. And now, get this, 2/3 of their counties, that's 93 counties, they either have 0 home health providers or just one.
To one provider for a whole county or none at all?
Exactly. Think about travel times, availability. It's tough. Or look at Maine and Well Health Partners. They're a big provider there.
Right.
Late last year, they had to pull back services significantly. Went from serving 144 communities down to just 58.
And they said that was because of reimbursement.
Directly linked it to low reimbursements, yeah. And it's not just providers feeling it. The American Hospital Association, the AHA, they're concerned too. They're worried about hospitals, If home health options dry up, where do patients go after a hospital stay? It puts a strain on discharging people safely.
Okay, so the picture you're painting is pretty grim for providers. But I understand there's another way some people are looking at this, a different perspective.
That's right. It's not universally seen as just a negative. Some analysts, like Joe Widmar over at West Monroe Partners, they have a different take. They suggest these cuts might actually speed up industry consolidation.
Consolidation, meaning bigger players buy up smaller ones.
Sort of, yeah. The idea is that the more efficient providers, maybe the ones better leveraged with technology, could acquire the smaller, maybe less efficient operations. It could streamline things in theory.
Interesting. Does everyone agree with that assessment?
Well, Corey Mertz from Mertz Taggart, he agrees that tech definitely helps efficiency. But he adds a really important kind of warning. He points out that these larger acquiring companies might not be interested in buying operations in rural areas.
Because the patient numbers are lower.
Precisely. So even with consolidation, you could still see these rural communities losing out, ending up with even fewer options or none at all.
Here's the undeniable truth. What looks like a financial adjustment on paper can quickly become a fight for survival for vital patient services on the ground.
And that really brings us to the current situation. There's this ongoing debate, a lot of uncertainty. I mean, CMS, the Centers for Medicare and Medicaid Services, they have adjusted proposals before. Just look at 2025. The initial proposal was a 1.7% cut, I believe, but it actually ended up being a small increase, 0.5%.
So there's precedent for them changing course.
There is, but most people think an actual increase for 2026 is pretty doubtful given the size of this proposed cut. So right now, home health companies, the trade groups, they're really pushing back hard. They're talking to CMS, trying to make their case.
And what's the core of their argument to CMS?
It really boils down to value. They're stressing how cost-effective home care is, keeping people out of expensive hospitals or nursing facilities. They argue it improves patient lives, keeps them comfortable at home, and saves the whole healthcare system money in the long run. They're saying this cut undermines a really valuable part of the system.
So it's a balancing act trying to manage the budget versus potentially destabilizing a service that many rely on.
Exactly. How do you maintain fiscal responsibility without losing essential care access, especially for vulnerable people in their own homes? That's the core tension here.
Before we go, if your practice is navigating these complex billing landscapes, know that human medical billing helps U.S. practices fix billing problems, improve collections, and take control of their revenue. Visit humanmedicalbilling.com to learn more, sign up for the free weekly expert billing newsletter, and get a 100% free, no-strings practice analysis, no commitment required. Thanks for listening to Expert Billing Talk. See you next time.